So we are going to be testing the patellar reflex, and we want our patient to be sitting like this, legs dangling over the table. And what we're going to do is you're going to use the reflex hammer. We're going to hit the knees, and we should have a slight kick when we hit the knees. Okay. And you repeat the same thing on both legs, both knees. So again, the normal response would be a slight contraction of the muscle. So that would be what we're looking for. A no response or an exaggerated response is abnormal. The next thing we're going to do is check the Achilles reflex, and we would do the same thing with the reflex hammer, hit the patient on the back of the knee of the patient to see if there's a contraction. Okay. Alrighty. Okay. So again, we're gonna hit the back of the back of the foot and see if there's a contraction. And let's do this leg. Okay. Next thing we're going to look at is the plantar reflex, which is also known as the Babinski reflex. So we're going to use the end of the hammer to elicit a superficial reflex whose receptors are in the skin rather than in the muscle. So with the end of the reflex hammer, we're going to stroke the lateral aspect of the sole of the heel to the ball of the foot, curving medially across the ball. And we're going to repeat it on both sides. A normal result would be the flexion of the toes. An abnormal result would be the toes fan out. The toes should only fan out in infants, but in adults, you do not want that. That would be considered a positive Babinski response. So, again, we take the end of the reflex hammer, and we're going to pass it along the toes. Okay, and we want the toes to go in like this when we're doing that. So you know. So we're gonna do the same thing. Okay, on both. And we got the appropriate response, which is the toes curling in instead of fanning out. Alright, and the last but not least is we're going to do the abdominal reflex. And the way you do this, you're going to lightly stroke the abdomen on each side above the umbilicus. And this will evaluate the function of the spinal levels T8, T9, and T10 with the upper abdominal reflex and spinal levels T10, T11, and T12 with the lower abdominal reflex. What we want is the abdominal muscles to contract. The umbilicus deviates towards the side being stimulated. Abnormal results would be superficial reflexes may be absent with lower or upper motor lesions. So basically you would it says you would lightly stroke the abdomen on each side. Okay. and above the umbilicus. So this is the umbilicus. We're lightly stroking, and we want the abdomen to contract, which is what happened. Okay. And we would do the same thing on the lower end. All right. And again, it contracted, so that is what we want. All right, and that concludes the reflex assessment.